Hello, everyone. A few of us are still trickling in, so I'll give it another minute and they will begin our webinar today. Thank you for joining us. Well, hello, everyone, and welcome to today's webinar. My name is Michelle Woodhill, and I'm the Senior Director of Development at Dr. Susan Love Foundation for Breast Cancer Research. For those of you who are joining us for the first time, I'd like to take an opportunity to introduce you to our organization. Dr. Susan Love Foundation challenges the status quo to end breast cancer through innovative research and improve the lives of people impacted through education and advocacy. We drive collaborative cutting-edge research with non-traditional partners, shed light on the collateral damage of treatment, and actively seek ways to diminish it and interpret science to empower breast cancer patients. Many of the projects that the foundation undertakes are designed to increase our understanding of the human breast, where breast cancer starts, and what enables a malignancy to occur, with the ultimate goal of developing methods to prevent it in the first place. The foundation is also committed to participation in research that has the potential to positively impact the lives of people who are at risk for or who have had breast cancer. Breast cancer happens in people, so research needs to be done on human beings, and that means men, women, non-binary people, everyone who gets breast cancer. Our Love Research Army is committed to encouraging and facilitating breast cancer research in all people, regardless of age, race, gender, sexual identity, with or without a breast cancer diagnosis. We are committed to thoughtfully engaging our members by providing them with ongoing real-time access to an array of studies. Today's webinar is part of the Love Research Army study series, where we invite the researchers who recruited participants from the Army to present their findings to our community. Joining us today is Dr. Deanna Attai, who will be presenting the results from her study titled The Male Breast Cancer Collateral Damage Survey. The purpose of this pilot study is to help researchers learn more about the primary areas of concern among men who have been treated for breast cancer. The initial call to action for the study was on February 2nd, 2021, and the researchers closed enrollment on February 16th, 2021. The study enrolled 68 participants, many of whom were sourced through the Love Research Army. Dr. Attai will be available to answer specific questions related to her study from our viewers at the end of the webinar. So please submit your specific questions using the Q&A box. While we will try and answer as many questions as possible, please note that we may not be able to address every question today. Now I'll turn things over to Dr. Attai.
Thank you. Thank you, Michelle. And thank you to the Love Research Foundation for partnering with me on this study and for giving me the opportunity to come and share the findings with all of you today. So just a little bit of background about male breast cancer. It is considered a rare disease. About 1% of all breast cancers occur in men. And in the US, that translates to about 2,600 cases per year and about 500 deaths per year. Contrast with breast cancer in women, which is about 260,000 cases per year and about 40,000 deaths per year. Male breast cancer is often treated in a similar fashion as breast cancer in women, but we don't always have the data to confirm that we are actually treating men with the best available option. And a big challenge has been that male breast cancer is not as common. So either historically clinical trials have excluded men, and so we don't have any data whatsoever, or the studies in men are so small that we don't get meaningful data. And so there is now a new FDA advisory for any breast cancer studies, especially of pharmaceutical agents, that men should be included, and that small numbers of men are not a reason to exclude them. So we are very slowly making some progress in terms of getting meaningful information about how best to treat breast cancer in men, because it does seem that in many ways it's a very different disease. And certainly the experience of a man going through breast cancer treatment and the survivorship phase after active treatment is very different than that of a woman. And so that's one of the reasons that I was very interested in doing this study. Next slide, please. And so this study was a partnership between myself, I'm an associate professor of surgery at UCLA, the Love Research Foundation, and also the Male Breast Cancer Coalition. And I think the first call that we had on this with Dr. Love and representatives from the Male Breast Cancer Coalition was back at the end of last year, really talking about how to advance just knowledge in the area of the male breast cancer experience. Next slide. And so what we decided was to look at the collateral damage of cancer treatment in men. And we used as a model the metastatic breast cancer collateral damage project that the Love Research Army and the foundation launched a couple of years ago. And that study was very helpful in terms of gaining information about the experience of those living with metastatic breast cancer, which is of course very different than the experience of those with early stage breast cancer. So what was done in the metastatic collateral damage study initially was a pilot study to just get a better sense of what the issues that those with metastatic breast cancer were facing. And so we thought that would be the best way to start is ask the patients, what are their challenges and what are the issues that they are really struggling with in their survivorship phase, and then use that information eventually to help inform a much larger and more comprehensive study. And so we developed a very short survey in partnership with the Male Breast Cancer Coalition and several advocates. And it was just 5 anonymous open-ended questions. Next slide. We distributed the study both via social media, 3 ways, social media, through the Male Breast Cancer Coalition email listserv, and also through the Love Research Army email and social media posts. We asked basic demographic information. We asked men to describe what they felt was their most significant collateral damage related to treatment. We asked them to share the effects of the disease and treatment on all aspects of their life, focusing on physical, emotional, psychological, and financial aspects. What resources were helpful and what advice did they have for other men? Next slide. And so we had 68 respondents, and while that doesn't seem like a lot, most studies of breast cancer in men have fewer than 50 participants. So I was thrilled that within, I think it was just 1 to 2 weeks, we had 68 responses. The mean age was 69, with a range from 34 to 87. And the most common collateral damage that men described was sexual dysfunction, peripheral neuropathy, musculoskeletal complaints, and fatigue. And common themes were fear of recurrence, being self-conscious about their appearance after surgery, negative impact on sexual function and intimacy, and financial hardship. Regarding support, the most common sources of support that men found were online resources, and many specifically called out the Male Breast Cancer Coalition as a strong source of support, family, friends, and faith. And in looking through this, some of these common themes and the common collateral damage are similar to that has been described in women and experienced by women. But some of the things that we were a little bit surprised about was the self-conscious about appearance. And I think many of us, speaking as a surgeon, that just was not on our radar as an issue for men. We certainly understand that women, there are many studies of body image in women after breast cancer surgery, but there's really no data in men. So this is at least from my perspective, a very important finding, and has already led to additional study specifically in this area. Next slide. And when we asked men for the advice that they had for others, again, common themes were be your own advocate, seek out others for support and networking, and prepare for a pink world. Many men commented on how being a man with breast cancer is, one, a very isolating experience because there just are not a lot of others like them out there. As opposed to women diagnosed with breast cancer, there's a built-in huge network of patients and patient advocates and survivors. But also, as a man going through breast cancer, many of our even facilities, our breast centers, our imaging centers, our oncology and surgeons' offices are decorated in pink because that is the default breast cancer color. And many men just found that really challenging, kind of wading through this pink world as a man with breast cancer. And so from this, first of all, one of the reasons we closed the study so quickly, once we realized how many responses we were getting, the American Society of Clinical Oncology's abstract deadline was approaching. And we felt, why don't we try and submit this as an abstract since we had so many participants? So that's the main reason we closed the study so quickly. And it was accepted as a poster presentation at the annual meeting. And so the link that's at the bottom of the slides links to the full abstract if anybody's interested in looking through the entire abstract. And so next steps from here, I hope to partner with the Love Foundation to develop that more comprehensive collateral damage study. I know the Male Breast Cancer Coalition is a ready and willing partner on that to really get more detailed information about the experience of men. And then hopefully that will lead to better tools to help alleviate the late effects, to really get a better sense of the impact of this collateral damage on quality of life. And out of this information, we can hopefully gain enough knowledge that we can then make specific recommendations on how to educate our clinicians, the breast surgeons, the oncologists, other researchers in this field, to better take care of men with breast cancer, because it is a very different experience and a very different disease than that in women. And the time is definitely past for us to just treat a man with breast cancer the same as we would a woman. We really need to treat male breast cancer and men with breast cancer as the individuals that they are, and tailor our treatment and our recommendations to them. And if you go to the next slide, at this point, I will be happy to take any questions. And again, I thank you for the opportunity to present, for the partnership, for the commitment to researching breast cancer in men, and I'm happy to take any questions.
Thank you so much, Dr. Attai. If anybody has any questions, please submit them through the Q&A box. I don't know if you can see, but Peggy Miller says, thank you for all you do for MBCC men. And then she puts hashtag together we will change the world, that hashtag men have breasts too.
Thank you, Peggy. And thank you. Peggy has been, and everyone at Male Breast Cancer Coalition has been so supportive. And I can't thank you all enough. And yeah, it definitely is a partnership. The researchers can't do it without the patients can't do it without the researchers. So yes, together we will make a difference.
We do have some previously submitted questions. I do see that there's a couple other ones. Dr. Attai, you described male breast cancer as being very different from breast cancer in women. Can you be specific about the difference?
Yeah, so some of the disease aspects are very similar. Ductal cancer is the most common breast cancer among men. Lobular cancer is actually very, very uncommon in men because men have milk ducts, but they generally do not have lobules. The point of the lobule is to produce milk, and men generally do not do that. So the overwhelming majority of breast cancers in men are ductal, so that's similar to that in women. Men tend to be diagnosed at a more advanced stage, and part of that is because of men are not generally screened like women are. You know, women generally starting at age 40 or 50 will go for annual or every other year mammograms. There is no routine screening in men. Also, some of the delay or delay in diagnosis is because men just in general, and I don't always like to generalize, but in general, men do not pay as much attention to changes in their bodies as women do. And there still, unfortunately, is very much a lack of just general awareness of male breast cancer. So a man may be aware of a lump in his breast, but may not even come to mind of the possibility that it might be cancer. And that, unfortunately, that lack of awareness isn't just in the men themselves, but also sometimes in their primary care physicians. Many men report that my primary doctor never even checked my chest area. Or when I pointed out the lump, they said, oh, it's probably just a cyst or just an enlarged tissue, and generally nothing to worry about. So we definitely have a lot of education to do on the part of not only men in general and their partners, but also physicians. But going beyond that, there do seem to be some biological differences with breast cancer among men, and we're really just starting to sort that out. Kind of similar to how in women, the disease in, for example, African Americans is probably a different one than the disease in Caucasian women. And so there are differences that we already know based on research in women, based on race or ethnic background. There are probably other differences that are going to be teased out as far as male breast cancer as well. Like I said, we're really just at the tip of the iceberg there for trying to understand that.
Great. Thank you for that valuable information. The next question is, can you say a little more on what the sexual dysfunction was about that you alluded to in the survey results?
Yeah, men with breast cancer, most male breast cancers are estrogen receptor positive. And so men are often treated with tamoxifen, similar to women. And so many respondents noted that they either were not able to have an erection or maintain an erection. Many men, just like we see in women, reported a significant impact on just libido and interest in sex. And because of body image concerns, again, similar to women, there's plenty of research in women that it's well documented that their body image issues or concerns after surgery have a negative impact on their sexual health and sexual function. Many men reported the same thing, as just feeling very self-conscious. Just like in a woman that undergoes breast cancer surgery, a man that has a mastectomy, and many men are treated with mastectomy, the skin of the chest wall is numb, the nipple is often removed. And just like in women, it's an important organ. The nipple is an important, and the breast is an important organ for sexual function and sexual arousal. So some of that parallels what we see in women. I think what was a little bit surprising was that it was a very common theme. Surprising mainly because we just don't have that data and we just don't know. But it's becoming clear that this is an area of, it's a significant quality of life factor for men, significant impact on their lives, and definitely an area where more research is needed.
Great, thank you. The next question is, where is data on male breast cancer collected? For example, SEER data.
So SEER data is collected. Again, numbers are very small. But there are just very few, and National Cancer Database will have information. So that's collected just like any other cancer data is reported by institutions and collected. The challenge is usually that there are such small numbers, and SEER, or National Cancer Database, doesn't collect all of the information, doesn't often collect quality of life information. And so this collateral damage and quality of life information is just kind of hanging out there. And not enough people are paying attention to it. I will say there is a large multi-center study called the International Male Breast Cancer Project ongoing. I believe the principal investigator is Dr. Sharon Giordano at MD Anderson, who has done a lot of work in regards to male breast cancer. And that study is looking to collect not only the biologic data, so cancer type and stage and outcomes based on treatment, but there is a quality of life component to that as well. So that I definitely want to shout out to them, because it's a major international effort, and it will take a major international effort like that to collect enough information and enough data so that we really get meaningful results and we can start making some progress in terms of just the male breast cancer experience.
Definitely, absolutely. Did you collect ages when diagnosed, stages, as well as ethnicities?
We did not. And the reason we didn't is because as a pilot project, we wanted to keep it as simple as possible. I honestly was only expecting 10 to 15 respondents, because that's all you really need to, we think of a pilot project almost like a focus group. We just wanted to be pointed in the right direction. Of course, when I saw how many respondents we had and how enthusiastic the men were with responding, we were all kind of kicking ourselves, because we could have gotten a full research paper out of this if we had had all of that more detailed information. But we at least felt we had enough to submit as an abstract, so we scrambled and got that together. So at least that information was out there. But yeah, when I saw such the enthusiastic response, I, had a little bit of pangs of regret. But, part of the challenge is you get a good response sometimes when you have a very short, simple survey. The next phase, the more comprehensive, will absolutely have all of the detailed information. So the request that I have at this point is that the men are just as enthusiastic about filling out what will be a very long and detailed survey that they were with this short pilot project, because that's where we're going to really get that, do that deep dive into the experience and be able to tease out, hopefully, racial or ethnic differences, or differences based on the age at diagnosis, or how long ago the treatment was. How far are you from active treatment? Are you still experiencing the same problems years or even decades later? So any of the men that are out there listening, any partners of men with breast cancer, please just be ready for this really long, comprehensive study, and hopefully we'll have just as enthusiastic a response.
Well, I'm thinking positive thoughts for you on that one.
Thank you.
Our next question is, based on the survey, should men also be required to get a bone scan?
A bone scan?
I think a scan, and maybe the person could clarify if this is incorrect, but hold on, they just added a bone scan possibly for MBC. I'm not 100% sure.
Okay, for metastatic breast cancer. So that I would defer completely to the individual's medical oncologist. So for early stage breast cancer, both in men and women, we do not normally do systemic imaging for looking for metastases, certainly in more advanced stages or if there's symptoms. I will clarify, when I mentioned the musculoskeletal complaints, it was more along what we see in women in terms of joint pains and muscle stiffness and things like that. not specifically symptoms related to bony metastases from metastatic cancer.
Great. That answered another question. Someone also had musculoskeletal. They specifically said any reason why those complaints.
Yeah, probably because of the endocrine therapy. So similar to women, we used to think that it was only related to the aromatase inhibitors, but many women on tamoxifen have bone and joint pains and muscle stiffness, and men reported similar findings.
Interesting. The next, we have lots of questions, and you're doing a fabulous job. It's very informative. Is there a cellular genetic difference? I'm assuming this person means between men and women.
Yeah, a cellular level that I'm not aware of at this point. Again, I would just say there's just not enough research that's been done. Genetic wise, I will say that any man diagnosed with breast cancer, regardless of age and regardless of family history, absolutely meets national guidelines for hereditary cancer testing. That's a little bit different than the guidelines in women, where it's a little bit more based on age at diagnosis and family history. Any man with breast cancer should get genetic testing because male breast cancer is so rare. It is more likely to be associated with a BRCA mutation, especially a BRCA2 mutation. Now, similar to women, most of the cancers are sporadic, meaning they're not related to an identifiable genetic mutation. But again, can't stress it enough. Any man with breast cancer needs to be referred for genetic testing.
Oh, that's very good advice. I did not know that. So thank you.
You can always learn something.
Yeah, no, absolutely. Is there a higher correlation with family history and mutations? Well, you sort of answered that, but if you had further.
Yeah, having breast cancer in the family increases risk and increases, especially if there is a known mutation in the family, then that certainly increases risk. But most breast cancers, like most cancers in general, are not related to an inherited mutation. What you also have to realize is that there are mutations that we just haven't identified yet. We've learned this over the years as genetic testing has evolved. There are some patients that might have tested negative for a BRCA mutation, say in 2010. Well, the national guidelines recommend anyone who was tested in 2010 to before 2012 to 2014 be retested with broader panel testing, because we've identified more genes responsible for hereditary breast cancer and also more mutations on those genes. So it's evolving. But again, most breast cancers are not related to a known genetic abnormality.
Great. How did you define collateral damage in the questionnaire, and what method of analysis did you conduct?
So this was just I'm blanking on the word right now, but this was not a statistical analysis. This was really looking at trends and themes. Again, this is to inform a pilot study to inform a larger project. We defined collateral damage as, we use those 4 groups of physical, psychological, mental, financial, and effects on interpersonal relationships. But we intentionally did not provide specifics to the men as far as this is what collateral damage is, because the reality is any area that a man or a woman who's been treated for breast cancer, anything that they feel as a result of treatment has now impacted their life, that is considered collateral damage or a late effective treatment. It doesn't have to be a known side effect from a medication, for example, to be considered collateral damage. So I'll give financial impact of treatment as a perfect example. The financial toxicity or financial impact of treatment is only really in recent years been recognized by the American Society of Clinical Oncology, ASCO, and others as a major, quote, side effect of treatment. But that's not something that was ever assessed in early studies, for example, looking at the medications related to breast cancer treatment. It just wasn't a question that was originally asked. So it doesn't have to be a known medication side effect to be considered a significant problem or a collateral damage or a late effect of treatment. So we intentionally left the definition very broad because we really, for this phase of the study, just wanted to hear from the patients. What are you guys experiencing? What are your problems? What are your issues? What are your challenges?
Great. And then we have one last question here. So if anybody has any additional questions, I know Dr. Attai is here to answer further questions, but the last question I have is, will the survey participants' email info be saved for future surveys? 68 is great. However, 100 would be better.
It sure would be. We kept the survey completely anonymous. So we did not save email addresses. We didn't even log IP addresses or anything like that. Again, going forward, I know the Male Breast Cancer Coalition has a large email database, and I know the Love Research Army also has a large email database. So we will certainly be tapping into both of those for the next phase of this project. And then using the power of social media as well. And hopefully anybody listening here who knows anyone in their life affected by male breast cancer will have them sign up for the Love Research Army or Male Breast Cancer Coalition so that they'll be among the first to be notified when the next phase of the study goes live.
Fantastic. And Peggy just said she's there with the MBCC and willing to help and support in any way.
I know she is. She's tireless in this, and we can't do it without her.
Absolutely. Fearless leader there. So if those are all the questions, if anyone has any further questions, please let me know. Otherwise, there's one more question. Mm-hmm. Any future work on Previvors? Oh, sorry, and everyone's coming in. Okay, great, guys. I love this.
I don't have anything else planned. That certainly is an area. I mean, again, there's been a lot of work done in women. It's just another area that needs research and maybe a partnership with Force, basing our risk of cancer empowered. So they are, for those that don't know, they are a hereditary cancer, not just breast and ovarian, but a hereditary cancer advocacy organization. So maybe that's a good project in partnership with Force in the future. Because I'm sure they have a lot of male previvors that tap into their resources. So,
yeah, that is also a wonderful organization.
Yeah.
And the next question I have is, can left breast versus right be counted in the future?
Of course, we can include anything as long as the challenge is getting people to answer the surveys. And definitely the longer the survey, people tend to drop out. We had 68, full-on enthusiastic responses to this. We need to keep that momentum going. And I just can't stress enough that, we're only now, how many years into research, only now really starting to understand the differences between breast cancer in men and women. Without male participation in these studies, we will not get more answers. We will continue to treat men in the same way that we treat women. And it's becoming clear that in some cases that's just not appropriate. And we may learn, in another, who knows, 5, 10, 15 years, we may be treating men with breast cancer in a completely different fashion. But the only way we'll make that progress is if men participate in research, actively partner with us. We want to advance the field, but we can only do it with their help.
Yep. Great contributors to all these patient advocates.
Yeah. Really, the sky's the limit in terms of what can be looked at and addressed. with enthusiastic partners and participants.
Yeah, definitely. Well, I'll do one last call for questions. These have all been amazing questions, and thank you everyone for participating and submitting these questions. I know Dr. Attai really appreciates it.
Absolutely.
So thank you again, Dr. Attai, for joining us. Oh, and someone mentioned that it would be good to include non-metastatic patients as well.
Oh, absolutely. Yeah, no, the original collateral damage study was in women with metastatic cancer. The male breast cancer collateral damage study, we are including regardless of stage, regardless of metastases or not. Again, because there's not a lot of men with breast cancer, we want to be as inclusive as possible. So this collateral damage study, we didn't specify stage or metastases or not. It was open to anyone. And the collateral damage, the larger project, I anticipate will also be inclusive, because we can then sort out the experiences of men with and without metastases. In a previous study that I did, also with support of the Love Research Army, when we looked at the experience of endocrine therapy, both in men and women, we included everybody, regardless of stage. So this next phase will definitely do that as well.
Fantastic. Well, thank you again, Dr. Attai, and thank you for partnering with the Love Research Army. Well, we still have time. So someone has put in another question. As a caregiver, can we participate in future surveys?
So this one was specifically for the patients, and I think the collateral damage one probably will be specific for the larger study, will probably be as well. But that's a really good point, because there's also not a lot of research on the experience of caregivers. So maybe a partner study to the collateral damage project will be a survey specifically for caregivers of men with breast cancer. Really great question, and definitely an area where we need more work, because we don't really know how to best support our caregivers. And they're such a crucial part of the patient experience, and an important component to their outcomes. So great idea to include. Maybe we can put in a companion survey or something like that when we launch the bigger.
Great, that is a wonderful idea. Yes, the person said thank you for answering that. We do need information on caregivers. I'll leave it open for another minute if anyone has any additional questions. Thank you so much, Dr. Attai. This has been incredibly informative, I know, for the participants here, as well as for myself at the foundation and others from the foundation participating. If there are no further, oh, sorry, go ahead.
No, I was just going to say thank you to everyone at the foundation and Male Breast Cancer Coalition. Thank you to all who have submitted questions. I mean, the enthusiastic response really just reinforces that this is an area we need to keep working on. So, we all like positive reinforcement. So thank you for that. And it's a little bit of the motivation to really get going on the next phase of the project. So,
yeah, it's fantastic. We love seeing the enthusiasm too. If you have a question that wasn't answered today, or you'd like to get in touch with the foundation about the Love Research Army, or if there's a question that you come up with, tomorrow or later on, feel free to email us at info@drsusanloveresearch.org. And today's webinar has been recorded and will be soon posted to our website, so you could share it or view it later. And the link is also in the chat box for your convenience. So I encourage you to visit our website if you're interested in learning more about the foundation or making a donation to support our research studies. But I'd like to thank each and every one of you who participated and joined us today, and especially Dr. Attai for that wonderful presentation and answering all of these enthusiastic questions. So I hope you all are staying safe and healthy. And Dr. Attai, if you have any closing remarks, feel free, but thank you all.
Just thank you so much again for the opportunity and for the partnership. Really appreciate it.
Oh, and we appreciate you.
Thank you.
Well, thank you all. I hope everyone has a wonderful rest of your day.
Take care, everybody.